morning, everyone, or good afternoon in my case, if you're from the UK. Welcome to this inaugural event. It's a very special and amazing day. We appreciate you joining us for what should be an exciting 2 days of insightful conversation and knowledge sharing. So I'm going to introduce our first speaker for today, who is the Chief Executive Officer of the Global Action Network for Sickle Cell and Other Inherited Blood Disorders, GANSID. So that is none other than Mrs. Lanre Tunji-Ajayi. As the founder of the Sickle Cell Awareness Group of Ontario and the co-founder and founding president and CEO of the Sickle Cell Disease Association of Canada, Lanre's leadership and advocacy are instrumental to the greater visibility and recognition of sickle cell disease in Canada. Through Lanre's ongoing advocacy, Canadians living with sickle cell disease continue to benefit from improved patient access and disease-modifying techniques and therapies. Lanre is committed to addressing disparities in care while strengthening equity, diversity, and inclusion in the Canadian healthcare system. To support these efforts, Lanre was instrumental in the establishment of both the Ontario Hemoglobinopathy Patient Association and the Radicalized Health Initiative Working Group. Her efforts to build bridges across organizations dedicated to sickle cell disease are increasingly worldwide in scope, but most notably through her capacity as a co-founder and the founding president and CEO of GANSID. She currently serves as numerous tables in the federal, provincial, and municipal levels of government, not limited to the Project Heart Advisory Committee, Health Canada, the Black Health Summit Table, the Quality Standards Advisory Committee, and the Health Connect Ontario Stakeholder Advisory Council, as well as the Public Engagement Review. The City of Toronto meets with Lanre for her hospital leadership, and they regularly meet to improve the quality of care received by individuals with sickle cell disease in Canadian hospitals. And she's also a member of the University of Health Network's Emergency Department's Sickle Cell Working Group. Lanre is also a consultant leading to pharmaceutical companies involved in developing innovative therapies for SCD. In recognition of her continuing advocacy and leadership on behalf of individuals living with SCD and their families, Lanre is a recipient of the Governor General's Meritorious Service Medal, the Senate Canada 150 Award, and was recognized as one of the 100 accomplished Black Canadian women in 2018. So without further ado, I'll pass it over to her to begin our opening session.
Thank you very much, Dapper, for that very generous introduction. And depending on where you are joining us from today, I wish you good morning, afternoon, and evening. It's an exciting privilege to host you at the inaugural Congress of the Global Action Network for Sickle Cell and Other Inherited Blood Disorders. It is truly an honor to welcome you, friends, to this historic gathering of the hereditary blood disorders community and the official opening of the Congress. We are in difficult times with so much unrest and tension in the world. And as a community, we must stand with humanity, praying for peace in people from across the world. For the next 2 days, we will be together virtually. And I wish to thank every one of you for taking the time to be here with us. Your presence shows that you see a gap and you want to be a part of the solution. As a collective, we will bridge the gap. Whether people with hereditary blood disorders live in low or high risk of countries, every single one must have access to the right care at the right time. As you are aware, the theme of this year's Congress is the power in the collective. And during the next 2 days, we will deliberate together as a collective on how to move the inherited blood disorders forward. We have a lineup of expert speakers, plenary sessions, regional workshops, and industry alliance symposiums, and you do not want to miss any part of the discussion. Without taking much more longer, I wish to acknowledge the GANSID Board of Directors, every individual who is part of the planning of this Congress, the industry partners that provided financial support, AGU, Novo Nordisk, Vertex, and Roche. Your support has brought the hereditary community together in a way that has never been done before. I'm also grateful to the Task Up Global Consulting for its in-kind support. This team has been awesome. Thank you so much. And to every Congress participant, I want to thank you for helping us to make history. Now, to officially open the Congress, I would like to hand it over to Sarah Ford, the CEO of the Canadian Hemophilia Foundation, and to Dr. Soji Jemitola, the executive lead at the Sickle Cell Awareness Group of Ontario, Canada, who are the co-chairs of the GANSID Strategic Plan Working Group. They will present to you the strategic plan framework that their team has been working on for the last few months. I want to thank you again, and I wish you an enjoyable and impactful Congress. Over to you, Dr. Jemitola and Sarah Ford. Thank you.
I'd like to take this opportunity to introduce my co-lead for the Strategic Planning Working Group for GANSID. And it's been a pleasure to work with her and the rest of the working group over the last series of months as we work towards this particular moment in time. Currently the executive lead of the Sickle Cell Awareness Group of Ontario, Soji is a veteran in the multi-industry, energy, oil, gas, manufacturing, and extractive, government and private healthcare, education, and retail sectors. Experience in delivering ESG program design, change management, process redesign, and organization transformation initiatives. A proven people engager with the ability to transform vision into action, convert nebulous concepts into concrete approaches, and translate information into audience-tailored communications. Past roles include SME lead, organization and social performance for Trewan Oil Limited, program director for Health Intel SL, change lead for Africa Development Bank, change and process lead for NLNG, and regional implementation lead Africa for Shell, and business consultant for Accenture. Thank you very much for joining us today, Soji.
Thank you very much for the introduction, Sarah. It is my pleasure to welcome you all to the GANSID Conference 2023 and to introduce my co-speaker and co-chair of the GANSID Strategic Working Group. A truly wonderful person. She's a nonprofit executive and strategic communications professional with more than 20 years of experience in both the nonprofit and private sectors. Sarah Ford is currently Chief Executive Officer of the Canadian Hemophilia Society, CHS. Prior to joining CHS, Sarah held several leadership positions at both international levels and within her local community. She was Executive Director of the Montreal West Island Women's Center, WIWC. She worked with the World Federation of Hemophilia for over 10 years, holding several positions, including Director of Strategic Communications and National Director of WFH USA. Sarah served as Vice President of Communications on the Board of Directors for the Montreal Council of Women and served on the Board of Directors for Edward Connexion. Welcome, Sarah. It's been a pleasure working with you, and I'm very glad to make this presentation with you. So we'd like to start our presentation to you on the working group framework. The Strategic Plan Working Group, made up of 9 professionals and representatives of IBD organizations, was tasked to develop the framework for GANSID strategic plan with inputs from patient organizations, healthcare providers, health organizations, professionals, and academic societies, as well as industry partners that serve people impacted by inherited blood disorders. Our charter involved using a deliberate planning process to engage stakeholders in translating GANSID's vision, mission, and objectives using a collective lens of IBD member organizations into specific and tactical priorities. I would like to talk a bit about the 5-step process that we used. Our first step was to establish the parameters for the framework using the GANSID mission and vision statements. We then actively solicited input from other stakeholders. To date, we have received and incorporated input from 51 member organizations and 18 stakeholder organizations. Countries represented include Nigeria, Canada, Uganda, USA, Kenya, Zambia, India, to name a few. And I am glad to see that these organizations are present at this Congress. Again, thank you for your attendance. We coalesced all the feedback we received into clear strategic priorities, which we are now sharing and validating with you. So please do feel free to share ideas, questions, comments in the chat. We will address your questions as well as recognize your comments and suggestions in finalizing the strategic plan. A key component here is inclusive engagement. My co-speaker, Sarah, will now take us through the mission and vision statements to set the context for us to delve into the strategic priorities in more detail. Sarah?
Thank you, Soji. I'm going to now move on to how we started to build up and lead to the strategic priorities. As many of us are aware, we need to start first with a vision leading into how do the strategic priorities relate back to our mission and objective. And upon every evaluation of the strategic priorities, I encourage everyone to think about this. How does it go back to the mission and who we're trying to serve and what we're trying to achieve as an organization? The vision is a strong and united sickle cell and other inherited blood disorders patient and healthcare provider communities equipped to effectively advance disease state and cross-disease priorities that improve outcomes for affected families. And that includes the keywords of both collaboration and also communication with the different disorders that are within our community. When we talk about our mission, we are going through the collaboration, we are advancing cross-disease initiatives and working towards improving the outcomes for people living with sickle cell and other inherited blood disorders. I won't go line by line with this, but I encourage you to also refer back to the GANSID website, which includes all these objectives. And when we were setting forth in terms of our priorities, we wanted to make sure that we related most of our priorities back to these core objectives. Now, strategic priorities are really the big picture. And as you all know from working with your own organizations, they need to be reevaluated, but the objectives should always be remaining the same. And we should be looking at our strategic priority through that lens of evaluation as we go over the years with GANSID. So I'll begin with the first strategic priority. And when we are looking at what our objective is for this particular area, we received much feedback in terms of how we could possibly execute this objective. We heard about enhanced collaboration and partnerships with healthcare professionals. We looked about having how to reach campaigns to hard to reach or remote areas, rural areas. What is the data sharing amongst the different groups? And what type of education awareness programs we could achieve this through. So the strategic priority for this is to advance disease state and cross-disease initiatives in country where collaboration is feasible. What you'll see at the bottom of each of these strategic priority slides are really the big picture ways that we might be able to work to achieve these strategic priorities. These are not the tactics. That gets developed later on when we have agreement on the framework. But really, when we're talking about specific and cross-disease initiatives, we're looking at creation of those collaboration opportunities, the promotion of collaborative, and looking at the unmet needs. Soji?
The second strategic objective focuses on empowering member organizations to not only leverage innovation, but also to shape and direct such innovations to meet their needs. While there's a great need for capacity building and resourcing, especially in countries like Africa, the Middle East, or South America, connectedness and resource sharing are quite limited across IBD patient advocacy communities. So how does the priority equip inherited blood disorder patient organizations to shape and advance efforts that ensure the promise of new innovations can be fully realized for all? How does that priority statement address this challenge? By aligning our programs and tactically implementing these programs to maximize their efficiency and impact across the board. On the slide, we have included some of the comments that were received. For instance, coordination and effective ongoing communication, training of trainers for disseminating knowledge on inherited blood disorders. These are all strong and valid points. The key point arising is establishing and monitoring programs to address identified gaps. Again, I'll prompt you, please, if you have any comments, please share them in the chat box as we go along. We'll address it at the end of the presentation. And now moving on to the next objective. Sarah?
Thank you. So GANSID's role within the international community, especially when we're talking about sickle cell and other inherited bleeding disorders, is to act as a central spoke to be able to bring together all the different areas that are needed, whether it be mentorship, knowledge gaining, compiling, disseminating information, data collection, etc. Feedback that we had received from the international community is everything that we should be doing should be empowering the patient and the caregivers. We need to focus on the data compilation, the data collection, the data sharing, and the generation of evidence and sharing that evidence. Because as we know, in these days, every area of support needs to be able to tie back to actionable items. But we also have a role to play in curriculum development and mentoring. So the strategic priority would be to identify trainings and workshops that increase knowledge where there are gap and unmet needs. This is a very key item because we're not looking to duplicate. We're looking together to bring together all the knowledge experts in areas where there is no opportunity for training and workshops and to increase the collaboration. We talk about core competency and specialized trainings. There are various ways that we as an organization can do this, bringing together many groups who have a general goal, general objectives that match, but also identifying different areas, different countries, different organizations that might require specialized training. We need to always convert back feedback and surveying to, again, what we're actually doing. Are we actually hitting what we need to be doing for unmet needs? And of course, data collection activities. That should be woven through most of the trainings and workshops that we are doing so that we can also evaluate where progress is being made. Soji?
I won't read through the objective here, but the key thing to note is the priority arising from this objective is to develop regional patient networks, which will help build capacity in countries with unmet needs. That's a lofty goal, I think, but how do we progress on this particular priority? We will work together on shared concerns to increase capacity, coordination, and collaboration through a regional network model. Each region will build its capacity to address its unique challenges while leveraging the strength of other regions as well. Each region will have a voice, manage that voice, and amplify it through and with other regions. However, what we have currently is a lack of connectiveness at the global and regional levels. This limits the opportunities for collaboration and has increased duplicative and wasteful efforts, a point I think Sarah referred to in the last slide as well too, right? So instead, with this objective, let us leverage economies of scale to get the maximum returns on our resource investments. With this GANSID objective in mind, our efforts and resources will be greatly streamlined to the better benefit of the communities that we serve. And that leads us to the fifth objective of the framework.
Thank you. From this objective, we are really looking at how we can increase collaboration. And for all the work that we do for patient communities, we know that there are multiple people involved and need to be involved to make sure that we're advancing our goals and our missions. So one of the challenges that we had noted during the feedback process was a declining specialist population. Was how do we actually improve the patient outcomes and increase the expertise of healthcare professionals and to build the comprehensive care system that meets the needs of the patient communities, regardless of which inherited blood disorder area is being covered. So what we are recommending through the strategic priority is the collaborative advocacy initiatives between both patients and healthcare professionals. We need to look at how can the care and treatment infrastructure grow and strengthen. Where we look at the idea of supporting governance development needs. Each organization has different needs with regards to starting, strengthening, building capacity. And if GANSID can help with the idea behind a governance structure, that allows for more stability of patient organizations as they go forward with their advocacy initiatives. the inclusion of healthcare professionals in the committee structure. We want to make sure that the comprehensive care model is aware, or there's awareness around the comprehensive care model of the benefits, and we can only do that through collaboration with the healthcare professionals and the sharing of global and regional best practices. If something is successful in one area of the world, it could most likely be successful in an area. It doesn't need to be sickle cell to sickle cell or hemophilia to hemophilia. The importance here is the cross-disease state sharing of these best practices. Soji?
This sixth objective not only brings together elements of the previously discussed items, it also underscores the importance and power of information. Data from global IBD patient organizations and communities will provide insights to deepen our understanding of the needs of our IBD patient, caregiver, and healthcare professional communities. It will help us inform creation and execution of appropriate capacity building initiatives, and ultimately shape and advance global and regional advocacy initiatives. I hope this point has been kind of made clear through the whole presentation on all the objectives, right? Transforming that body of knowledge into global and regional best practices will significantly leapfrog our progress towards advancing our shared goals and concerns. Ultimately, we'll be able to amplify the effect of our unified and coordinated advocacy efforts. Again, I won't read through the elements on the slide, but this shares some of the feedback that we received when we shared these objectives with the communities that were mentioned earlier. I'd like to go on to recap on all 6 objectives. The 6 objectives are compiled together on this slide. They would like you to indicate which are your top 3 priorities in the chat box as we do this recap. Also, any comments, questions, feedback you have, please share in the chat box and we'll address them in a minute or two. I think we're good for time, Sarah, right? So we'll look at that in a few minutes. The related strategic priorities from all 6 of these objectives reflect key themes from all the input received from our respondents. These themes include collaboration, funding, addressing underserved populations, advocacy, capacity building, and most importantly, I think, partnership. We welcome additional comments, suggestions, criticism as well too, please, and questions as we finalize this strategy. Again, I'd ask you, share your feedback directly in the chat window or through the feedback link also posted in the chat window. We will now take a few minutes to answer some questions that might have come up earlier. And while we're doing that, we're also going to post a poll that also asking for your feedback as regards this particular presentation. The poll should come up in a few seconds. And in the meantime, we'll also take questions.
One question that came up, and we encourage you to use the QA function on Zoom to ask your questions. But we had received one question saying, do you have a method for harmonizing data collection? I can use an example from my perspective, and then I invite Soji or Lanre to also give their feedback. When we're talking about data collection, there should be a consensus also on what we're collecting the data for. And I've participated in various core outcome set discussions, at least within the area of hemophilia. And one of the things that really is important is that we are all working on the same page. If we're using advocacy tools, we need to make sure that we are collecting the same type of data so that we can compare different situations in different countries. There are certain things that certain organizations do in terms of data registries, and there's a lot of best practices out there for data collection data registries. And it's also important to know within your own country if these data registries already do exist at a health ministry level or at a healthcare professional level. So I would say at the end of the day, it has to be a needs awareness, but also has to be an environmental scan of what's been happening. From a GANSID perspective, there should be some harmonization about one of the areas that we're looking to evaluate and collect the data for our programming. Soji, do you have any feedback?
Yeah, thank you very much for that, Sarah. Another question that we had here, it says, you mentioned that you used input from GANSID's member organizations in developing its strategic priorities. Is GANSID's operations limited to only its members? And what are its membership criteria? GANSID's operations are geared towards empowering and amplifying the impact of all patient organizations in the inherited benign blood disorders space. Again, a key concept is collaboration and partnership. Membership simply ensures that the respective patient organization is engaged, heard, and well represented. Each patient organization must represent an IBD patient population and have organizational goals that are similar to and not in conflict those of GANSID. I think that'll be the only criteria really, right? Because we are working together. To become a member, simply complete the membership form. I will post the link shortly in the chat for a window as well. So you complete the form and we'll be glad to welcome you on board. Thank you.
Another question that we had through the chat feature is, how do we ensure that our focused disease areas don't overburden an already constrained health system, but instead are as integrated as best as possible? From a very top level point of view, that is one of the big important features of GANSID, is that we're speaking with a unified voice. When we start individually advocating for each area, we're missing opportunities to have a larger collective voice. Coming from someone who works within a rare condition, we know that there is power in numbers in terms of our advocacy initiatives. And where there's places that we can collaborate, what we're coming to is those already constrained systems, potential solutions. So for example, if there is a way to have a comprehensive care model set up within a certain country that maximizes healthcare professional expertise, specialist use, and also patient engagement, that is already a solution for a constrained health system. Lanre, Soji, do you have any feedback to that question? Lanre, maybe I might ask you to speak to GANSID's objective in terms of addressing these constrained health systems that are out there right now.
Thank you so much, Sarah. And I think you hit, the nail on the head with your answer. So this is the whole purpose of GANSID, which is to talk as a collective, come together as a collective, right? So there is merit in that. And even with government at national level, you find that when disease areas, different disease areas come together, governments are more open to really, provide resources, because you're not going individually, you're going as a collective. We have done that in Canada. We know that it works for us with hemophilia, thalassemia, sickle cell, advocating together. And that's exactly what we're trying to do, to reduce the constraints on the already stretched, healthcare resources by speaking with one voice, right? And representing all disease areas under hereditary blood disorders together. And that way, we know that if we replicate this in other countries, what we've done in Canada that is successful, if we do the same in other countries, government will see that, well, it is reduced resources that they have to use, and it will be easier for them to listen and do what the community wants. So there's power in the collective. It's very important. Thank you.
And it's not coincidental that that ties into our theme for the conference, does it? The power of the collective.
Soji, do you have any other questions on your end?
Yes, I do. Thank you, Sarah. Let's see. We have a question that says, you reference collaboration in some of the strategic priorities. How do you suggest we do this? Okay. I would, okay, sorry, you want to take this?
No, you start and I'll follow.
Okay. So how do we reference collaboration in the strategic priorities? Okay, yes, thank you. It helps to identify a common goal that is important to both parties. If it's two different disorder organizations that may have different priorities, one challenge might be addressed by combining forces. Again, the power of the collective comes here again, right? For example, advocating for similar resources in a care and treatment setting. Once working together on a common issue, it just allows for us an opportunity to address some of our common challenges with a common collective power.
And one follow-up point to that is that there is so many gaps in terms of where we can support community members across the world. There is no reason to worry about duplication of efforts if we are working together as a collective, meaning that communication, that transparency. The ultimate goal is to improve the quality of lives and to improve the way that patients are served across the country, across all disease states and disorder states. So the idea is that at the very bare minimum, if we are working together, we're aware of where everyone's headed. And there will be opportunity for collaboration. This will come up organically, but also it's important that all organizations are speaking to each other and continuing to be transparent.
And if I may just chime in, I also want to add that collaboration will happen for disease specific and also for cross disease initiatives. So let's say, sickle cell disease, for instance, we have so many organizations working in the sickle cell disease space, but most of the time, A doesn't know what B is doing. If we all come together, we have this specific goal that we want to push, and we can do that as a collaborative, and GANSID can support the work in that area. And then there is also the opportunity for cross-disease collaboration where sickle cell is working with hemophilia, with thalassemia, aplastic anemia, Fanconi, and all of these anemias, again, in different countries, it might look differently. For instance, let's take Nigeria, for example. There is no thalassemia patients organization in the whole of the country of 220 million people. It's very disheartening that babies will be born with thalassemia or other, hereditary, blood disorders, and they might not even be identified, and they might die, right? If we can have a thalassemia organization in Canada working with Hemophilia Foundation of Nigeria, working with the sickle cell organizations, they can go together to the government and they can advocate for resources for these babies, starting with, for instance, newborn screening. How do we ensure there is universal newborn screening for hemophilia, for sickle cell, for thalassemia? This a major hereditary blood disorder needs to be screened all over the world. And you cannot, sometimes you can't do it alone. You need to go as a collective. When you go as a collective to the government is saying, well, if we prick the heel of a baby, take the blood from that baby, why do we have to screen sickle cell alone? We can checkmark sickle cell, hemophilia, thalassemia, and so on and so forth. So there is power in working together, in collaborating to really move the hand of the government. And that we must employ not only for cross-disease collaboration, but also in some instances, depending on the situation, for disease-specific work. Thank you.
Thank you, Lanre. We also have another question that came up. How have you ensured that the voices of global IBD organizations have been captured? And how will you avoid losing those voices when it comes to implementing GANSID strategy? I would like to point out that at this forum, you do have the opportunity to share your feedback as well to ensure that your voice is captured. We've shared 2 links by which you can provide feedback in the chat. So please take advantage of this opportunity as we finalize the strategy. But to directly answer the question, we took a multi-layered approach to ensure that collaboration was the guiding principle, starting from the composition of the GANSID board and that of the working group. We then actively sought feedback from the IBD community via a stakeholder questionnaire that collected feedback on the proposed strategic objectives and the ranking of those opportunities from the perspective of each respondent. All these have now been analyzed and are now presented at this session for your feedback, please. So please use the feedback channels that we posted in the chat so that we can also capture your voice going forward. With the feedback from this session, we'll be in a position to finalize this inclusive strategy, which will drive all GANSID operational plans. And in that way, we'll ensure that we do not lose the voices that we have captured at this stage. And finally, GANSID will ensure collaborative implementation of these operational plans going forward. Thank you very much.
Okay. At this point in time, we'd like to ask if there are any final questions that can be put into the chat. If not, at this point, the voice can still be captured, as we had said, through the strategic plan feedback form. Please do not hesitate to do so. Our goal throughout this conference is the working group members will be attending and participating in the different regional workshops, getting clarification and asking questions. So please also during your regional workshops, let us know if there's an area that we think we need to fine tune or evaluate going in a more a different direction or a similar direction if there's any feedback. At that point, I would like to say, please, if you can, fill out the closing poll about how this session goes. And I would like to thank the Strategic Plan Working Group and my co-speaker and co-chair of this working group, Soji. It has been an absolute pleasure working with you over the last couple of months, and same with the Strategic Plan Working Group members. We very much appreciated everyone's contribution to both the feedback and also the development of the strategic plan. Lanre, we'll turn this back over to you now. Oh, hold on a second. I think you're still muted.
Again, I'd like to thank you, Sarah and Soji, for clearly presenting our strategic framework and allowing the participants to have a clear understanding of what GANSID aims to do. And as you've clearly said, it's not finalized yet. So people who have now provided input into the strategic, plan survey can do that. So we have shared the link. Feel free to do that, and also please complete the poll. And I believe the next session we have is happening at 8:50 a.m. And that is the I believe that is the Power in the Collective, the vision for GANSID. During this session, you will hear from Mr. Cesar Garrido, who is the president of the World Federation of Hemophilia. You will hear from Dr. Atleti Nati from Lebanon and from Mr. Riyad Elbert from Canada here. And that session is moderated by Jennifer Bryan. Please join us on that session, which will be happening, I believe, in the next 8 minutes. Thank you again for attending this session, and we'll see you at the next one. Thank you.
Thank you, everyone. Enjoy the rest of the Congress. Thank you, Sarah. Thank you, Larry.
Thank you.
Thanks, Soji, and thanks, Lanre.
Thank you.